Welcome to Blockchain in Healthcare today, April 16, 2021. My name is John Gomez. I am your BHTY Florida chapter ambassador. At BHTY Florida chapter, we establish a robust network of blockchain thought leaders in Florida and facilitate adoption of blockchain technology in the healthcare industry. We promote thought leadership, innovation, and transformative initiatives that can facilitate large-scale deployment of blockchain technologies. We identify blockchain technology thought leaders and key stakeholders in Florida, expand network of BHTY readers subscribers, develop implementation standards and ethical guidelines for blockchain deployment, promote value proposition for blockchain technologies. We also offer virtual educational blogs, webinars, and podcasts, produce scientific white papers, live networking and educational events, social media marketing, foster community partnerships. For more information, please visit www.bhtyflorida.org. Our roundtable today addressing healthcare challenges via blockchain, and we can address or point a number of issues in the healthcare system such as care coordination, data security, and interoperability issues. And because of blockchain technology, we can also address solutions to these issues, such as electronic health records known as EHRs, interoperability, supply chain integrity, and smart contracts, just to name a few of the possible solutions using blockchain technology. But first, let's introduce our speakers today. Aman Quadri, he's the CSO and acting COO at Fintech. Shiv Aggarwal, he's the CEO at Earthld. And Kishore Kumar, he's the CEO, founder, and chief data scientist at the ConsilX.
Healthcare has a lot of problems. I've been in healthcare for a long time, but I think that where let's talk about just use cases themselves, right? I mean, we can dive deeper into it, but around identity is one area that it could be down. Supply chain management, things where we're trying to take a look at, for our current example, vaccine movement. How do we track vaccines? How do we make sure they get to the right place? How do we make sure that they're maintained at the right temperature and they're dosed appropriately to the right people, right? So there's a lot of things where we can cut out middlemen or equations out of there. Interoperability, right? You mentioned it before on EHR side, right? The ability to move data from let's say one organization's health record to another, utilizing safe, secure methodologies, right? Or to that method, what about leaving data where it is, work on that data, take out what you need, and then walk away from it and maintain the data and management, like federated learning types of approaches, right? And so I look at that, and then there's other things like credentialing, management of physician, tokens or access, or their, or their, licenses, et cetera. And then clinical trials, right? I think there's a huge opportunity to be able to manage through clinical trials, and I think that we'll cover some of those things with the other guests on there. But that's where I would say at a high level. I mean, I could go on and on with the list, but that's where I would at least try to poke a hole and start.
So I would agree with Aman that the laundry list is very, very long. But I think some of the key focus areas, basically, which we can talk about is data silos and ownership. Because if you look at this, right now, when we look at around the world, the way the healthcare data is managed, it's very, very fragmented, and then it's not also interoperable, right? And that is where it causes massive challenge with respect to how healthcare services are being provided, and also how healthcare records are being maintained, right? That creates one of the biggest bucket of challenges. Secondly, it's also with respect to how the the professional credentials are being managed, right? Because obviously a lot of frauds around the world happen because there are a lot of fake and fraudulent professional credentials which are being used to get access to data to provide services, and which cause a lot of different type of challenges and frauds. And lastly, it's also about user privacy and consent, right? Because when we talk about a doctor-patient relationship, it's very, very, I think, private in that sense. And this is where the question of privacy and consent becomes paramount, right? How do we ensure that the data that is being exchanged between the doctor and the patient, that is private, that stays private, and then it is only used for the purpose that it has been exchanged for, right? And also, obviously, I think there's this question about how can that data be used for research purposes, and that is where the question of data ownership comes again, right? How do you ensure that the data that is being used for research has been properly massaged, and then only it's just used by different organizations, because obviously at the end of the day they are going to monetize it as well, right? So this is where the key challenges would be data ownership, privacy, consent, and then in general with respect to the data interoperability.
Maybe Aman alluded to a very specific point on clinical trials. And Shiv did speak about a relationship, which is the patient and the doctor. So in clinical trials, this relationship transforms into a different role, the individuals and their expertise being same. So in clinical trials, what we call as an investigator and a subject. So all the points which have been explained by Shiv and Aman holds good even clinical trials too. But when it comes to clinical trial optimization, there are two main pillars which we one need to address to. One is patient centricity, another one is digital enablement. Patient centricity has been spoken in very forms and shapes in terms of engagement, in terms of safety, and all those things recently. At the same time, advent of wearables, devices, and sensors, IoTs to collect data from patient has grown now. In this situation, what happens is the clinical trial model, which is traditionally revolving around a site, moves to the patient and their home care setting. When you are moving from a supervised data collection methodology to an unsupervised data collection methodology, lot of issues come into discussion because this industry being highly regulated industry. And blockchain brings in two words into that. One is trust, another one is transparency. So when I say trust and transparency, it talks about identity of the subject, it talks about provenance of the data, it talks about the process in which data collection is being done, and how rules can be defined to make this entire data collection process robust, auditable, and reproducible. So blockchain takes care of the entire conduct part. When we are going to talk in terms of now the new normal, individuals are speaking about decentralized trials and hybrid trials and virtual trials, which are going to be the new normal. So blockchain comes in the right way to address challenges which will be posed by regulators.
Open-ended question there. There's a lot of things you can do. I think where our focus lies, right, is, and I'm a huge proponent, is around data ownership, right? I believe that if you produce that data, whether you go into a doctor's office or whether you do anything, that data belongs to you, right? Whether, and how do you get involved in not only understanding where it's being used, why it's being used, how it's being monetized, but what's your play within that, right? Since it's yours, you should benefit from it too, right? Whether it's the monetization or whether it's the use of it for research, right? So my thing is I believe the huge opportunity is for people to understand that their data is theirs, that how it's being leveraged, and what is the ability for them to have clear and concise access to it at any point in time, no matter which healthcare system or participant that they're part of, whether it's a clinical trial all the way down to your family practice doctor. You should be able to have insights into it at all times, right? Including wearable devices, right? There's so many people that are wearing their Apple Watch or wearing some other device and not realizing how that data is being leveraged on a day-to-day basis. Yes, we sign consent forms all the time. We do, without reading them. It happens. I mean, I was in practice, and I would say maybe 1 out of 100 patients that I ever had actually read anything, right? So, and so I think we've given away our liberties quite a bit, and I think that it's for the individual to take them back. And I think that's where not only blockchain, but actually companies that are thinking about things doing things ethically bring that to the forefront, right? And that's where I think the opportunity lies. Is if I can tell you what your data can do for you, then you may take more ownership of it, and it actually impacts you long term from a health perspective.
So I think we are living in society 5.0 now, where basically the boundaries between the digital and the physical world, they are diminishing, right? And that is where I think the importance of the data is paramount now, right? There's so many, I think, statements like data is the new gold, the new oil, whatever you want to call it, but that is the most important aspect in this new digital age, right? And also with the advent of these, because of pandemic or in general, I think the focus on telemedicine, the focus on online health platforms, the exchange of data has become, I think, has lot increased, and because of that, new challenges with respect to frauds and thefts is becoming greater, right? And that is where blockchain technology has the potential to transform healthcare, placing the patient at the center of the healthcare ecosystem and increasing security, privacy, and interoperability of health data. Blockchain can make health records management and exchange safe and secure and frictionless. Also, blockchain-powered self-sovereign data and identity solutions can provide verifiable credentials for healthcare professionals and patients, empowering them with data privacy and consent, and thereby massively reducing identity thefts and credential frauds. So, in general, I think blockchain. Obviously, it's like it's not a silver bullet, right? It's not that magic pill, but obviously, it has the potential of addressing a lot of the challenges.
Generally, there are many organizations are now working upon use cases of blockchain in clinical trials. I just now got out of meeting, which is a fuse working group. Right? So the examples are many, starting from patient recruitment, patient identification, data sharing. And the data sharing is not sharing just data amongst patient, etc. It is even sharing some medical records among researchers. Fine. And informed consent is a very classical example of application of blockchain, which every collaborating group is now speaking about. So all these are very specific examples of use of blockchain. And in fact, I belong to this organization where we have built an entire platform which is based on blockchain and tracks the journey of patient starting from informed consent till his last visit. So opportunities are very many.
Well, I don't have all the solutions. You know, I mean, I can talk to some of the stuff that we've worked on, if that helps. You know, when our parent company runs multiple companies underneath it, and I lead our healthcare side of the house as well as our fintech side of the house. And when we started Amchart, which I still lead, and we acquired a company underneath it, our goal with it was to solve, like what Shiv mentioned, was the EHR problem, right? How do we create a single source of truth to be able to bring that forward, so no matter where somebody goes, they can do that, right? And so when we looked at the landscape in the US especially, I mean, it's a siloed, very convoluted landscape. I mean, to compete in an EHR side here is really, really difficult. It requires a lot of time, money, and effort. And frankly, people go broke on a daily basis trying to solve that issue, right? And so we looked at it from a global perspective and said, well, why don't we try to solve that, in a place that we know well, which is India, because we do a lot of business there and we've had a lot of inroads. And so we created our own center, which was a clinic. We created our own clinic in India to understand the use case around it. We created our own EHR system, which we iterated on multiple times, and we're leveraging different principles on it. And then we started aggregating data, because we feel like data aggregation is the long-term thing that you want to see within a population, so you can understand what's going on with them and propose different methodologies on treatment, right? And we made headway. We garnered millions of records, and then of course a small thing, COVID hit, and pretty much decimated our plans there. And so we shifted we were doing work in the United States on a different side. We were working with health information exchanges. We were working with different healthcare groups on trying to combine disparate sources and bring that data together, whether a patient has been across state lines or come together. And we started looking at the different pain points that were there. And one of the pain points that we latched onto was three things really, which we're now covering, which is medication data, right, which is a huge problem, social determinants of health data, huge problem, and then what we term internally behavioral determinants of health, right? And so we scoured the market. We found a company that we eventually bought that allows us to be able to get the medication history of up to 250 million people in the United States. So John, I probably have your medication data if I wanted to, and so what people don't realize is these databases and these silos exist. How do you enact upon that to really make a difference? And the key with it is not only the data to sell it, we can't because of our uses and our data uses. It's how do we use data to do real world use cases that allows us to be able to enact change in a patient, right? And so what we're doing currently right now is we are working with pop health programs, we're working with pharmacy hub programs and what we call MTM programs, so that we can look at the data, the medication data from somebody that goes back up to 7 years and understand what they've been on, where they're going in their journey, and are they on the right medications for their treatment plan. And so if you walk in, right, as a use case example, if I'm a VA patient and I walk in and I'm being treated at the VA, that's great. But there are a lot of people who go outside of that network and get treated and get medications, and opioid abuse is really, really strong, but VA never sees it. But in our platform, we can pull that data into one spot, covering disparate sources. And we can flag them and say, hey, this person took an opioid, but now they filled it somewhere else. This is a flag and you should look at it. On top of that, we are taking publicly available data, combining it, and allowing people, allowing these providers and social workers to be able to say, this person is a behavioral health med patient, but they have just now purchased a firearm because that's in public records. So can we combine that data to create a holistic view on a patient? And we're also taking a look at behavioral, what we call data. All the medications you're on have different side effects, and we can create, utilizing AI and a couple other things, a picture around what that looks like. So take all the pieces together and then be able to provide a one avenue of data, a single source of data that goes with healthcare data, that goes with something else that a provider is doing. And so that's kind of what we're looking at. But I can give you examples of other companies that are doing things on credentialing and things on ID and things on supply chain, because we've worked on that as well too. But there's a lot of great companies out there. It's just a matter of them getting to the forefront and really being showcased. And I'm happy to showcase those people because I'm big fans of theirs. So
let me start with one thing, right? That healthcare industry is one industry which is actually based on trust, right? I think the doctor-patient relationship is so trustworthy that I think if any breach happens, I think it's not just then about a fraud. It's about, I think, a breach of trust, right? So that is where I think the trust becomes very, very important. And I think the trust, whenever we talk about trust, the trust is usually established by exchange of identity information, right? And this is where, and anyways, Earthld is a decentralized identity management platform that allows secure and frictionless exchange and verification of identity information. So basically, it empowers data ownership, privacy, and consent while helping organizations avoid identity frauds and ensuring regulatory compliance. But when we look at healthcare, right, the key problem is that how do we ensure that the different stakeholders, they are able to exchange information about each other in a very trust and a frictionless environment. And this is where Earthld as a self-sovereign identity platform solves that problem. And the way you can imagine this is that you can think about health records or different professional credentials or other types of identities have three different stakeholders, right? So obviously one is the issuer of that particular data set, right? For example, it could be a government organization, it could be healthcare organizations, or it could be universities or professional colleges, which basically provide these identities or credentials, if we can call them that, to individuals, depending on what their role is, whether they're a patient or they are a healthcare professional or just in general other stakeholders. And obviously then there's that subject, right? Who is the owner of this data or identity? And lastly, it's about the verifiers, right? So the people who need to verify this information before they can provide the service. For example, when I walk into a doctor's office, he basically looks at some of my data and then ensures, okay, I'm Shiv Aggarwal, and then he has these medical problems, and now I have to basically treat those, right? So that kind of verification happens, right? Not explicitly, but it still happens. But when I look at it from a patient's point of view, so when I walk in the doctor's office, I'm just assuming that this doctor has the right credentials. But now you can compare this to online or digital world, where you are virtually meeting each other, and then there is no way for you to verify who is who, right? Whether the doctor has the right credentials and he can treat you, or otherwise, whether I am Shiv Aggarwal and I'm sharing my right health records for the doctor to basically, or the medical professional to basically give me the right prescriptions, right? And this is where, if a breach happens in this can actually create a lot of troubles. And this is where the concept of verifiable credentials becomes very, very important. Basically, that the issuer is able to issue these verifiable or digital credentials directly to user's wallet. So it could be a mobile-based wallet, it could be a cloud wallet, or it could be a hardware wallet. But the subjects or the owners of the data can carry their data within their wallets in a very privacy and consent-oriented manner. And then on basis of the use case, they can share this information with the requesting or the relevant parties, right? And they basically get the control with respect to how much information they need to divulge for a particular conversation or a scenario, right? And this is where this solution becomes very, very applicable, very, very relevant for healthcare industry, because it establishes trust. It creates a mechanism wherein the trust is not left as a byproduct. It's basically it's baked into the system. The trust is by design, and that is where uh, uh, self-sovereign identity solution is very, very, I think, relevant and critical for the healthcare industry. And then basically it will also allow that your healthcare records are digitized, your other identity information is digitized, and then you are carrying them in an interoperable fashion. But then you are able to basically use them on the for the right purpose, with the right mechanism.
Maybe, John, I would like to speak in terms of the natural design features of blockchain to solve these problems. Maybe I'll be going a little bit deeper. So, first, we know immutability is the core feature of blockchain. Fine. Immutability feature coupled with timestamping of events, which happens in a blockchain-based ledger, creates audit trails. Fine. These audit trails gives us higher levels of compliance, reproducibility, and also enables us to be inspection ready. A lot of time and efforts are spent on these activities now, and a blockchain based system will facilitate these things in an automated manner. Fine. Secondly, in what happens is in blockchain, the people, the devices, the various data sources are all cryptographic identities represented by key pairs. And this, combined with the power of smart contract, enables us to have effective identity and access management system, and gives us the required privacy and security. See, take for example, in a clinical trial scenario, it allows us to establish associations between devices and patients. Fine. Something which is going to be very, very necessary in the case of pairing the device, and the data is coming from the device. And this is the data which is generated by this patient. And we are going to do all our statistical calculations based upon the data which is going to come from that device. Fine. Also, finally, we have encrypting the data. We are storing the hash of the data in the blockchain, and it is immutable. Smart contracts, which are nothing but auto executable algorithms, and these adds a lot of values. These virtues help us to address issues which are very common and prevalent in clinical trial setting in terms of establishing integrity, giving reproducibility, and also ensuring compliance to the protocol and also to the regulatory requirements.
In blockchain, is that what we're looking for? I think there's a big trend towards what we call federated learning, which is solving the issue around data silos. What about leaving data where it is and working with that data on behalf of that patient and be able to do what we need to do, research, studies, understand the behavior, whatever you want to do. And encrypt it at rest, encrypt it in motion, use what we need to do and put it back where it was, and then walk away from it. So use it as needed and then move on. I think if there's a trend that's going to be there over the next few years, that's what it's going to have to be. That's the only way I think we really can start breaking through that data silo issue.
I think the decentralized management of health records and verifiable credentials paired with the physical and behavioral biometrics, right? That is what we are moving towards, and that would ensure that this can work in both high tech and low tech environments. So people can basically have portable records either on the smart devices or as simple as printing on papers. But it would be like you are able to carry your information in any environment and use that as per needs.
Maybe I'm going to align with Aman. So that's a pet topic what we normally speak to. Currently, there are several startups who are working on putting all these data together. Fine. We are going to have a unified view of the data, which is going to help us in creating accumulative evidence, both in terms of behavioral, predictive analytics. And this is going to offer a lot of value to the pharma in their current movement of moving from the traditional ways of conducting trials to the real world evidence trials. So primarily, blockchain will help in a very big way in combining all these data sources and to aggregate them in a unified manner. So that's my hypothesis.
Thank you. Well, you heard from our speakers today, and I want to thank Aman, Shiv, and Kishore for being with us today in the Blockchain in Healthcare today. We hope to see you very soon, and thank you very much, and thank you to our audience. Thank you all.